All right, we are now live on Facebook. Sorry for the delay, and welcome everyone to our conversation on mental health and social work, which I am so excited about. And thank you for joining us today. And if you're watching it later, thank you. Today is March 20th, and it is a beautiful day outside. So hopefully we all got a chance to be outside today. I am State Representative Lindsay LaPointe of the 19th House District, and I'm so pleased to be joined by State Senator Robert Martwick of the 10th Senate District. In the 19th House District, I represent the far northwest side of Chicago and some of the suburbs. And one of the reasons I'm so pleased to be having this virtual event today is because I actually worked in the field of social work for 9 years, and it truly created the foundation for why I was inspired to get into policy work first and start working on bigger picture issues, and then why I'm sitting here today as the state rep of the 19th House District. This month is actually Social Work Month, and I think that most people out there have an idea of what social work is, and when we hear the word, we think of things like school counselors, school social workers, we think of the child welfare system, and we certainly think of counseling and therapy. But because it is Social Work Month, I did want to take just a moment at the beginning of this event to talk about, just to touch on how broad social work is, because we're going to get into mental health and we're going to hear from social workers. But mental health is just one area under the big umbrella of social work. And there's some key differences in social work between social work and some of the other disciplines that touch mental health, like psychology and psychiatry. So in the spirit of it being Social Work Month and us all living in the city of Chicago, where Jane Addams is from, the founder, one of the founders of the field of social work, just want to give us a little orientation. And I'm going to actually read the preamble to the Social Work Code of Ethics, and these will be things that are familiar to our social worker panelists. The primary mission of the social work profession is to enhance human well-being and help meet the basic needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, who are oppressed, and who are living in poverty. A historic and defining feature of social work is the profession's focus on individual well-being, but in a social context, and the well-being of society as a whole. Fundamental to social work is an attention to the environmental forces or social conditions that create, contribute to, or address problems in living. So keep that in mind. I just had a flashback to my social work, master's in social work education. As we hear from the three social workers we're going to hear from today and talk about the field of mental health. And the three social workers we're going to hear from today really work in direct service, work in that counseling or therapy part of social work. So before I kick it over to my great Senator, Rob Martwick, just want to give you orientation to what we're going to talk about today and tell you the impetus for this event. So the impetus for this event was actually emails that I received from social workers out there in the field, some of which are on this call, reaching out to my office as state representative saying, there's a bill coming up to ensure that telehealth and people accessing mental health services during the pandemic through telehealth, there's a bill to make sure that can continue even after we get through the crisis that we're in. Because right now, telehealth was greatly expanded due to this moment of the pandemic. And I think what we're all learning is there are some pretty significant pros of telehealth, and perhaps we should keep doing it even beyond pandemic times. So real quick, so you know what you're going to get into today, we're going to talk about mental health overall and mental health during the time of COVID in particular. We're going to talk about telehealth, what are the pros of it? What are the cons of it? What is it? We're going to talk about some mental health legislation, because in Springfield, myself and Senator Martwick, we have a lot of, this is an area that we can really make some significant changes in with programs and also funding. And of course, we're going to have time for discussion and questions. So with that, I will turn it over to my good Senator Rob Martwick before our wonderful three panelists introduce themselves.
Thank you, Lindsay, and thank you, everyone. Lindsay, I don't know if you can allow me to turn on my video. I don't seem to be able to. If not, I can stay there with my picture up.
Got it. Well, I'll try to troubleshoot that.
Okay, no
to the
problem.
best of my abilities.
So first of all, thank you, Lindsay, for putting this together and for asking me to join you. My name is Rob Martwick, and I was the state representative in the 19th district for 7 years before Representative Lindsay LaPointe took over. And I'm now state senator of the 10th district, which of course is all of Lindsay's state rep district, and then another state rep district just to the north and west, the 20th state rep district. So I represent a large portion of the northwest side and the northwest suburbs, everything that Lindsay had mentioned, but also out into the 41st ward, so neighborhoods like Edison Park and Norwood Park and Oriole Park, and then out into Rosemont, Schiller Park, Franklin Park, Des Plaines, Niles. So I have quite a large district, and I'm very happy to be a part of this. You know, if there's one thing that I would tell everyone who's watching today is that, you know, by choice, a long time ago, when our forefathers decided to structure this government, they permitted for a citizen government, which means that we take everyday average citizens. Anyone can run for office. There's no test, there's no prerequisite. You run for office, and as such, you know, one of the challenges of the citizen democracy is that we are charged with voting on very important issues that in our normal lives we might not have any reason to know anything about. For me, I really didn't have a whole lot of reason to intersect with mental health, unlike Representative LaPointe, who worked in social work and intersected with it quite a bit. But that's the great thing about the General Assembly, is we bring our own individual experiences and we learn from people who bring those different experiences. And so it's really been a pleasure to work with Representative LaPointe and learn more about the challenges of how we deliver mental health services to our constituents. And so I've learned so much just in the year and a half that Lindsay's been a state rep, and it has helped me formulate some of my own pieces of legislation on mental health initiatives, which we'll be running through later. So again, happy to join here, happy to continue this experience of learning more about all of the good things that are going on, the challenges that we face, and hopefully working on some solutions towards those. So thank you all for allowing me to join.
Terrific. Thanks so much, Senator. And my skill set has never been technology. But while I throw it to the panelists to introduce themselves, I'll keep working on making sure our video works. So just for a matter of order, we'll just go with how I see people on the screen, and we'll have Nikki, Jamie, and then Laurel introduce themselves while I keep working on the video.
Thank you so much. Hi, I'm Nikki Jovasillo. And one of the great things about telehealth in this time is that we're all learning how to be more flexible and roll with it, because tech is a wonderful thing. I run a small psychotherapy practice here in Jefferson Park in Chicago, and we specialize in working with artists and trauma survivors. We use evidence-based methods for PTSD and working with couples. And it's been really incredible to start to see more and more of our profession getting involved in making sure that there's access for people who need it. So I'm excited to be here today. Thank you.
Thanks, Nikki.
Hi, I'm Jamie Edwards, and thank you so much for having me. I'm so excited to be here. I agree with Nikki about it's so great having legislators involved in this process and being concerned about mental health and health in general. It's such an important issue. I have a private practice that's in Ravenswood, also on the cusp of North Center and Lakeview by the Irving Park Brown line. I work with trauma and grief and the stress response, and also I think I'm able to start my video, so I will start this in the middle. Hi, everybody. And concentrate in body-oriented work, somatic work.
Hi, everyone. Thank you for having me today. My name is Laurel. I'm a staff therapist at a group practice in Logan Square called Practical Audacity. We mostly focus on gender and sex therapy for the LGBTQ population, but we welcome anyone to our practice. And I personally also work a lot with trauma and, managing effects of systemic oppression, anxiety, all of the things that you can come to therapy for.
Terrific. Thank you so much to all of you for being here to offer your different perspectives. I think the first thing that we're gonna jump into, and I'll see if the senator wants to start, but I'd like to start with kind of just mental health overall in the time of COVID-19. And I guess let's start here. We'll start pretty general. Kind of you all are in kind of counseling settings, but they're all a little different and unique, which I think is really important to highlight because it speaks to the fact that therapy and counseling and accessing mental health overall is not monolithic. There's many different ways that people can access the support that they need, and it looks different depending on what the practice is like and what the social worker is like. But let's talk about let's start with like pre-COVID and tell us about why and in what ways people have sought out the services that you provide.
I would say a lot of people sought us out for anxiety, depression, relationship work. And at Satya, we work a lot with ethical non-monogamy, with the LGBTQ community. So a lot of people who experience judgment or stigma in mental health settings would seek us out. And so that was the lion's share of who came to work with us before COVID. And the way that I've seen that change is I've seen a lot of people who had previously gotten to a place where their symptoms were managed and they go live their lives are coming back to therapy because the strain is so intense and it is such a heavy load on your brain to have this invisible threat outside that you can't see, you can't really tell who's carrying it. And we've gone from things that were very normal, from human contact being really normal to having a whole lot of rigid rules about it. And so I'm seeing people come back because of the stress of COVID. I'm seeing people take longer to recover and have their symptoms intensify with not having the kind of connection that we need. We're wired for, right? As humans, we're not meant to go it alone. And I've seen also an uptick in people now that we're seeing vaccines say, I don't know if I'm going to be ready to go back out into life because I've had all these rules about how I can't be in touch with anyone. And now I just feel like a failure as a person because I'm anxious about seeing humans again.
Mm-hmm. That's huge and something that I don't think a lot of people are thinking about yet. Jamie or Laurel, do you want to jump in and talk about how and why people come to you for support?
Yeah, like Nikki, we also, work with a pretty specialized population, a niche, and people, sought us out also for a place where they wouldn't be judged, would have their identities and life choices affirmed, right? And celebrated and encouraged rather than pathologized. So that is a big part that Practical Audacity tried to play for our clients. And we've, in this last year, also similarly seen anxiety rise a lot. We also work with a lot of couples and, relationship pairings, and the stressors of being inside together every day has certainly brought new challenges for how we work in, relational therapy. And yeah, it's anxiety is kind of the big thing, I think. We've already seen, anxiety and depression rise over the years, but this last year has brought a new wave with a whole host of symptoms and ways that it manifests that I think even as therapists have had to kind of quickly adapt to and learn about.
Quickly adapt to and learn about.
Yeah. Do you mind if I interrupt and just ask a question there, because it was something that was very good. And of course, I know we're waiting to hear from Jamie on this subject, but maybe that could be part of your answer as well. But I'm curious, I imagine that there was a lot of anxiety as we very abruptly shift from normal life to this lockdown, stay at home. I'm wondering if you're seeing that in your clients as the world starts to reopen, even though we're not there yet, but as we can see that as the vaccinations, there's probably this conflict between elation and just sort of fear. For me personally, I have two very small boys. I have a 4-year-old and almost 2-year-old. And I don't think the 2-year-old has really any effects, although I wonder what it will be like for him when he sees the change. But for the 4-year-old, I mean, 25% of his life has been locked indoors with his parents. And I wonder what that sort of anxiety is going to be like for him when he returns to school,
Yeah, I worked with children for a few years, and I think one of my first concerns when I learned about everything that was happening was how this would affect children. Just knowing the developmental needs that children have for socialization, and how 1 year is such a big chunk of change in a child's life. So I think that's going to be an issue that we are going to probably be doing a lot of research on in the coming years and decades, on how that is affecting, how that might affect our children, but hopefully be able to provide care quickly and responsively to kind of prevent any potential issues.
Yeah, I think, Senator, what you highlighted is very important. Before this time, people came to me mostly for trauma, because that's my biggest specialty, and also being body oriented. Sometimes working with other therapists that weren't covering the body, weren't covering somatic. And that was so important because there was something that was happening in their body that really wasn't being explained. And what I've noticed since is that people are more in their survival states. Like Nikki talked about, we don't have a sense of where this threat's coming from. It's invisible. We can't orient to it. And so we have this way that we're always on alert. We're always in a fight or a flight, or maybe even a freeze response. And so clients who, we were starting to really manage their symptoms, they're starting to have more triggers come up, and we're trying to normalize and just validate, of course, this is going to happen. And the part of what's so important is that these symptoms have effects over time. So they don't just turn off and on. which is why sometimes people come 10 years, 20 years, 30 years after the trauma, and they think they're doing okay. And then something happens and they realize, oh, I'm not doing okay. And this is the same thing we're going to see, is that this has been such a prolonged time. Now, maybe it would be different if we had gone back to things in May or June, but that's not what happened. We're experiencing this for over a year now. And so I think that is also why people, have, there's a predictability to their lives now, that then is now going to change again. So absolutely, I think we need to normalize and just validate, yes, of course, there's going to be fear. I think another thing I'm noticing is this hierarchy that's being created of those who are vaccinated and those who aren't. And that's going to continue, feelings of clients who are talking about, I'm seeing people connect with their family and I can't, or I'm never going to again because my family died from this, so it's really interesting, just all the intricacies that I don't know that we're quite aware of, and just trying to normalize and validate that for people. And then how do you work with that, all the feelings that are coming up, and why you might still need to set boundaries that are different from other people. Laurel, you also talked about, I think, relationships and how sometimes being in lockdown together has its own challenges versus being on your own, which is also challenging too.
And Jamie, if I could piggyback on what you were saying about the fight, flight, and freeze response, right? This is a crisis, and it's very easy in our culture to think trauma is when you see someone shot or when you're in a car accident, things that we as therapists often call the capital T trauma, where it's very obvious there's something you can point to. And there are other more complicated forms of trauma where nothing happened. So you could have somebody who just stayed at home and didn't get exposed, never even had to get a test, gets the vaccine, no incident, doesn't know anybody personally close to them who died, and still are experiencing a lot of symptoms. And when it comes to something traumatic, people often want to say, oh, I know it's worse in other places, people have it worse than I do, as if it's some sort of trauma Olympics where some people get to struggle and others, it's not legitimate. And I think that we see a lot of people carrying a lot of shame and uncertainty about, why is it so hard? I look on Pinterest and there's all these things saying you have all this extra time from staying at home, learn a language, right? Buy into our hustle culture, do more stuff, rah, rah. Why can't I get out of bed? Everyone else can. And so we're gonna see, I think, this major response to this traumatic stuff. I even saw, I think, a major collective neurocognitive event last month. Every therapist I know, every client I had hit a wall, because once we got to that 11-month mark and we're staring down the barrel of a year, our brain say, oh my God, is this my life now? And I saw everyone get so tired and hit this huge wall. And so I think that we're gonna see more of this brain fog and more people who have trauma responses and are thinking, but nothing happened. Why am I struggling?
We've used the word trauma a few different times, and Nikki, I love the distinction you made between capital T trauma, where something specific and, let's say, even like classic or traditional might happen, versus a trauma that is encountered when nothing specific happened. Can somebody just take a moment and kind of define what trauma is? Because we use that word now in our culture a lot, which I think is good, and it helps destigmatize. But I do think that sometimes we use words without actually knowing what they are.
A crisis is anything that overwhelms your resources to cope. And if you don't have the resilience and resources to process through the crisis, or if you don't have what you need, that's when it can encode in your brain as trauma. When your nervous system is flooded enough, your executive function, your amygdala, all this stuff in your brain is just totally focused on survival. It's not encoding your memories. you're not in an ideal learning state. You're probably real panicked. Jamie, as you were saying, in fight or flight for months at a time. And when something can overwhelm your resources to cope like that, it can be something like a car crash. It could also be verbal abuse. It could be emotional abuse, or it could be this global catastrophe.
That's really good orientation, and I don't want to take for granted that anyone knows what trauma is and the different examples of it. Another thing I just want to pause on and define and get some examples of are symptoms. If one or two of you wouldn't mind sharing, and I think this will help people recognize mental health issues and people that need support out in their lives and in the community. What are some examples of symptoms that the people that you work with might have because they're struggling with mental health? And actually, let's take it a step further. We'll get into this black box of what are some tools, just a few examples of some tools that you help people build up in themselves so they can help manage their symptoms.
I mean, one simple example I've seen is a lot of heightened irritability. Just kind of, I've seen a lot of clients say, I'm just irritated over like very small things these days. Like, oh, my partner forgot to wash the dishes and suddenly I'm so mad. And I was never like this before. And through unpacking where that irritability is coming from, it's because of, a deep-seated anger through everything that we've dealt with over the year. So a lot of times trauma shows up in these small ways of, why am I behaving like this? Like, why am I unable to respond to this in the ways that I truly intend to respond, right? Irritability, just overall kind of conflict resolution skills deteriorating. Social anxiety, just anxiety heightened around interactions in public, things like that feel small but are coming from a much larger place. And so oftentimes I ask clients to just slow down, right? Allow themselves to actually slow down in the moment and take a step back to walk themselves through that day. What feeling did I wake up with this morning? What are the things that kind of accumulated throughout the day? What kind of news did I absorb today? Did I get the things I needed today? Am I well fed today? Am I well hydrated? Did I sleep well? Did I get enough sun? Things like that. To actually do a body check of what resources, like you said, Nikki, right? When we don't have the resources to cope, what resources did I actually need today that I didn't get to have? And so when there is this very large resource that is depleted, right? Social interaction, kind of normal life, so to speak, stability, right? That is a thing that we all need. That's going to result in, all these symptoms that I listed. So just giving yourself kindness also, and being able to then explain to the people that in your life see that and say, hey, that's not, that wasn't you, right? That was everything that's happening right now. And let's start over, right? Let's kind of try that again.
I think something I hear a lot of clients talk about is feeling stuck, feeling like I was moving forward. I had these goals, and then all of a sudden I'm not moving. And of course, as Nikki pointed out, we play the comparison game, especially with social media. And so we're looking at everybody else. And I always try to tell clients, we're comparing our insides to other people's outsides. And that was from another therapist. I don't want to take credit for that. I had another consult with a therapist who said that. And I was like, oh, I'm totally using that. So I think one thing that's so important, it's such a bedrock, is slowing down, like Laurel said, being really mindful in the moment, and then really self-compassion. And how is this not you? How is this you being a human being? That really everybody experiences this as a human being. We're all having this collective experience right now. And then another thing, because I do work with trauma and body oriented, is that they're having a physiological response that they don't understand. Why is my body reacting this way? It might even turn into some type of physical symptom like migraines or some kind of disorder or fatigue. And so again, we're really slowing down, we're connecting with the body. And how can we connect with the body in a positive way, in a way that feels good, not just bad? Because a lot of times at this point, clients can only connect to their body in these ways that really don't feel well. So it's doing all of those things.
I think it's so important to say again and again, it sounds so basic, but the mind and body is connected. And I'm sure because some people have never been up close to mental health, or there's a stigma, it's not something they ever discussed in their family or with their friends, that when they have physical symptoms, which are actually a symptom of mental health struggles, that you just write it off like it's just a physical thing. I'll go to my primary care physician. When really it's more of a mental health issue. Well, let's talk about telehealth now. The new world of telehealth. And we all kind of know what that word means now. And it's a broad term that refers to getting healthcare remotely on the telephone or through video conferencing on a laptop. And mental health care is healthcare. And I know every one of you has been providing telehealth. So tell us about how that has been for you and the people you work with. What does it look like? What does it feel like? And how does it compare to in person?
I've been pretty surprised how similar it is, to be honest, and even some benefits. I think it's funny, clients and I have these conversations where we both admit, yeah, we didn't really know how that was going to go. And wondering, how are we going to do this? And is this really going to work? But both being willing to continue, especially given COVID and just all the challenges, and have been really pleasantly surprised that it's pretty effective. That it's similar in a lot of ways. There's resonance you can still have across the field, which is really cool. And one benefit that I found that I think is really great is, when clients would come into my office, there would be a million things they were coming in with. Oh my gosh, this just happened while I was driving. This happened at work, and they're throwing their things down and they're trying to get settled. They're trying to arrive into the space. And I'm just sitting there, okay, let's take some time. And now when we turn on the screen, I have clients who are already like, they got their pillow with them for support. They're in their comfy couch. They're all set. They're ready. And they don't have to do that commute, which also is really nice. They can come during lunch. They can, tell their boss, okay, I'm doing this for an hour instead of it being 2 hours, from the time they commute back and forth. So I've really enjoyed it. Obviously, I think there are things that are different from the office. And so, I know there are clients that are going to want to go back to that or maybe want to do both. But it's been nice to have that option. I think also, if either one of us is sick, we can still maybe attend depending on what kind of sickness we have. So I've definitely seen more consistency as well, which has been really nice.
I would agree, Jamie. It's really nice that when someone is sick, even if they have a sore throat, and not something like SARS-CoV, it's really nice that they can still have their session without getting anyone else sick. Because even in normal times, trauma survivors often have compromised immune systems. When there's relational conflict, that can also have an effect on your immune system, right? So someone coming to the office sick can get the therapist sick, and then people who are counting the days till their next session aren't going to get one. So just regularly for that, it's a wonderful thing. I have clients who have things like fibromyalgia or chronic illnesses that make even getting down the stairs harder. So certainly having access to telehealth improves access for a lot of populations. It's wonderful for people in rural areas who maybe can't access the kinds of specialists that they would like to, or be able to if they were in a bigger city or closer to wherever that specialist is. Some of the drawbacks I've seen is that when you're doing telehealth, it's not necessarily easier because you don't have control over the environment. So if you're working with a relationship and the individuals start arguing, you can't really get in between them. And if somebody is at home and some distraction comes in, it's a lot harder to rein it in because now you're a face on the TV rather than somebody who is there having that energetic face-to-face connection with them. And it adds to Zoom fatigue, which I certainly get in a big way. And I think a lot of us are getting. So there are a lot of really, really wonderful benefits to it, including and especially my cats making cameos, which is really a wonderful comedic relief from the intensity of therapy. And from an administrative standpoint, the biggest drawback I've run into is that it can be so challenging. If somebody, say, has an insurance plan that schleps telehealth out to a third-party vendor that hasn't accepted new providers in 3 years, or it's harder to verify if somebody has telehealth coverage. So its separateness from the other kinds of services we provide does certainly add a lot of extra red tape and legwork.
Yeah, I think you both summed up a lot of the pros and cons really well. I think that being able to meet clients from their own home, from my own home, is kind of a nice leveler in a way. So, when there's an internet outage and we have to deal with that together, we're kind of in it together. And it's been nice to meet clients where they're at and kind of have them see me also as just also a human going through this with them. I think the administrative drawbacks of worrying about insurance has definitely brought anxiety for therapists and providers, especially as we kind of keep looking forward and have to have that question of, is this coverage going to disappear one day? Like, when am I going to have to redo my whole business structure and contact clients and schedule them into the office and navigate the safety issues involved in that, figure out if we are allowed to ask clients whether they're vaccinated or not. Like, there's so many logistical issues that I know that we've been carrying for this whole year and just constantly wondering about. So I think that's part of why we all reached out to Lindsay to have this conversation, because we just want to have the assurance that insurance can have our back to actually just do our jobs without too many hoops to jump through.
I'd hope to ask what your opinions of telehealth are, but I think we covered that, which is good. What I'd be really curious about, and maybe briefly you can let me know. I don't know that it would necessarily or not, but Nikki brought it up, which is, of course, telehealth has always been touted as especially access to those people who don't have it, right? I mean, even pre-COVID, for those of you, one of you at least, if more of you are in, I thought, in Logan Square. Well, that's pretty convenient if you live in Chicago. You got to get to Logan Square. But what we hear about is access to mental health for those people living in rural and exurban areas where it's long commutes. Now that telehealth has happened, knowing that there is a shortage of providers down there, have any of you in your practices picked up anyone that you're assisting now from far away that you would have maybe not gotten had we not done this? I see a lot of nodding, which is good. That makes me happy.
I actually just had someone reach out to me from Carbondale.
Carbondale. See, and again, I remember pre-COVID, of course, the challenges about telehealth. People's interests can be somewhat parochial in the moment, unable to see the big picture, and so. As I always say with this pandemic, there are good things that come out of it. And I would suggest that someone in Carbondale being able to connect with a therapist that can provide them the relief assistance therapy that they need. I think that's a good thing. So yeah, that's great. So, well, thank you for that. Lindsay, where to go from here?
Well, let's just touch on the impetus for this conversation, which was a bill that would extend telehealth in a much more blanket way than we have right now, which, we have expanded access to telehealth right now because we're living in a pandemic, and the governor has used the power of his office to execute a lot of executive orders to make changes really quick, because we were and still are in a crisis moment. But as you just illustrated, Senator, there are so many things that we have experienced. We've been able to get help to people much more quickly, and that is something, and there's the cat cameo experience, that's something on cue that we're learning from. We don't need to have a pandemic to make sure people can access mental health via telehealth. And so there is a bill pending right now led by my colleague, Representative Deb Conroy in the House, who is the chair of the Mental Health and Addiction Committee, which I'm just so pleased that we have that committee to give space to talk about and really get into the details of any bills related to addiction and mental health that would extend this beyond the pandemic. And because historically in this country, we treat healthcare and mental health care differently, what we tend to do is say, oh, you can have telehealth for your healthcare, but not for your mental health care. Or you can have it, but your insurance, and Nikki, I want you to get into a little details about this because we talked about it before. But if we're going to give you telehealth for your insurance, it's not going to reimburse at the full rate, which is prohibitive for people. So with this bill, it makes it so if we pass this bill, and I'm very hopeful, then insurance will cover telehealth for mental health in a much more comprehensive way, even after we are out of this disaster period. So Nikki, can you just touch a little bit on the really concrete barriers to full, and here's another kind of wonky word. We know what this word means, but parity. Parity is a word we hear a lot when we talk about healthcare and mental health care. And in the context of this conversation, it means healthcare and mental health care are valued the same. Insurance will reimburse the same. So can you touch on some of the barriers to telehealth and mental health parity that you talked about before, Nikki?
Yeah. And this is Parity, parity. Parody is when, like Shaun of the Dead or Hot Fuzz, which are really brilliant parody films. So for this issue, it means, as Representative LaPointe said, treated the same. Some of the obstacles I've seen are things like insurers who have bought platforms or work with a third-party vendor that does telehealth on a specific platform. And if you want to sign up to provide telehealth with this particular insurer, you need to also go through a credentialing process, which is about 3 months to prove that everything all the other insurance companies know about you is really true. And get credentialed with this vendor in order to provide telehealth for a lower rate of pay. And with many of those telehealth vendors haven't been accepting new providers in Chicago for 3 years or more. So even if I wanted to accept less money to provide care for clients that I've been working with since 2014 or 2013 who have come back from COVID, I wouldn't be able to provide telehealth because even though I'm in network with their health insurance company, their telehealth benefits are something else that I can't get to. Or if it is, there's any number of companies who've started sending out notices saying, if your reimbursement for telehealth changes, if we decide to pay you less, you'll get 90 days notice. And gosh, we're all wondering why we're getting these notices, right? About just in case your reimbursement changes. And if it did, and we have enough people who have COVID long hauler syndrome, where it can add fatigue and brain fog for months afterwards, and a whole host of other wonderful things that could happen. Then not only would they have trouble getting access to care, right? If I have to pay my staff less, right, then they could go work somewhere else, or I would need to close down my office. Things that really aren't good for the local economy or for people who need care and don't want to have to go find a new therapist because the one that they've been working with for this whole time can't accept their insurance anymore. So I have seen those as some really huge obstacles to parity.
That's so important, and kind of, I think Senator Martwick and I were already on board to the value of telehealth, but for any of our colleagues who weren't, just hearing that from you is so compelling. And basically, if we don't move this bill and get it across the finish line, everyone here is going to go back to a world where all of a sudden some of their people they work with, or clients, or whatever word we want to use, will have less access to care. And maybe if they do still get care, everyone here takes in less money to do the job. And as we all know, helping professions, including social workers, are not valued in our society in terms of our earning power.
Right. I'm not here so that I can afford a second yacht.
Right.
Right. Why I got into this profession.
Exactly. Well, I want to turn to some other mental health legislation that we have pending. And I really look forward to hearing what Senator Martwick has on his docket. I think some things got through committee in the past week, but kind of the bigger picture, just to frame kind of why legislation is so important. Here's what I believe, and I suspect everyone on this call also believes it. Healthcare is a human right. Mental health care is not some separate thing. Mental health care is healthcare. And we just heard from Nikki how getting the right legislation in place will align our systems. So on the ground, people can access mental health care like the human right it is. And Senator, I know you have some legislation that moves us in that direction.
Yeah, Lindsay, I want to echo what you just said there about healthcare is a human right and mental health is healthcare. So I'm rather public. I'm not ashamed of it. In fact, I use it as an opportunity to inform people about a health challenge I had a few years ago when I had a heart attack. And, you know, the idea that mental health, right? I mean, obviously that comes for our brain, and how do you care for your brain, right? The idea that somehow or another that one part of our body is less important than others. I just can't imagine in a world where someone would say, oh, well, healthcare is good for every organ in your body, but not your heart. So with that heart attack, sorry, tough luck. I mean, we don't do that, right? So the idea that somehow or another we would apportion out, and of course, you know, as we know, everything goes through our nervous system. And so the negative effects, and I've learned this, and again, not that I would be an expert on it, but it's pretty clear. It was interesting to me through just years of testimony in Human Services Committee. I remember certain issues coming up where psychiatrists would come and testify that some psychiatric disorders manifest themselves not as a psychiatric disorder patently, but as a physical disorder somewhere else. And so, I mean, because the brain controls everything else. And so, yeah, mental health is so important. So thank you for that. And so I do have a few bills. Again, I love this process. I never would have thought that this would have been an initiative that I would have taken up 8 years ago. And yet here I am carrying a few bills, and I'm quite proud of them. So the first is the first two bills relate to police officers. Obviously, a challenging job in any time, but obviously with what's been going on in our society lately, a very challenging job. And we've seen it here in Chicago. In the last month, 2 police officers took their lives. Young men with families took their lives. You know, and it's just, it's almost unfathomable. You know, it's like, what led you to that? And so I've got a couple of things that are meant to address that. The first is very simply requiring the Department of Human Services to maintain a resource page on their website for police officers, so that when they're feeling mental health needs, that they can reach out to this website and find the resources they need to connect them to the services they need. And that's pretty simple. That one did pass out of committee, and I'm hoping that bill will pass on the floor and we'll send it over to the House. The second one's a little bit more specific. This is going to be the one where I'm going to tell you what it is, and you're going to say, every once in a while we propose a law and people will say, that's not a law already. And so what this does is it would qualify PTSD as an occupational disease for police officers, right? And again, you think about Chicago police officers, the job they do, and what they might see certainly on a far more regular basis than the rest of us in their lives. And so, yes, PTSD is not an occupational disease. It is not. So police officers don't have workers' comp. They get duty disability, so a disability related to the duty. And the idea that you could be suffering from PTSD, but no, you got to go back to work because that's not named as a occupational disease. So I have that bill coming up. And then the last bill that I have is very simply relates to students. And this is an initiative that's passed in a couple of other states. And I passed it last year, but COVID got in the way of us completing our work. And so I passed out of committee this week. And what it is it would allow students to take 5 days of excused absences for mental health reasons without having to provide a note of a doctor or anything else. So there is a limited number of excused absences that students can take. It doesn't expand those days, but it says that this is one of those reasons that you can take an excused absence. And, the idea, of course, is to, again, I'm learning as I go, but it seems like, and I think I'm a little bit older than everybody here on the call, but when I was a child, addressing mental health there was just stigma behind it. I've had these conversations with Lindsay where, the person who went to seek mental health was almost like, doing so made you an outcast. Oh, can you believe Joe's seeing a shrink? You know what I mean? It was like, oh my God. And so much of the involvement in this area is normalizing that process, removing the stigma, letting people know that not only is it okay to address mental health problems, but that you should, right? You should be encouraged to, if you feel you need to, find that out. And so this is, again, this doesn't make a huge shift in the way that we handle this, but it just says it's okay. If you need that day off, it's okay. Take that day off, address that mental health issue. And when you do, you're making not just yourself better, but everyone else you interact with is better off for it. So those are my 3 initiatives.
Tremendous. And I'm so happy that that is what's going on in the Senate. Bring it on in the House, get it out of the Senate so we can work on it in the House. Let me touch on a few bills that I have going on, and then I want to hear from you in the field to tell us kind of how this legislation sounds and what kind of impact it might have. And there's a bunch of similarities between what I'm doing in the House and what Martwick is doing in the Senate. I have a bill that is almost just like the 5 days off for an excused absence from school. And again, I can't say it enough. Why is that so important? Because it destigmatizes. It tells the world that this is legitimate reason to not be in school. And we know that many families do this already. Many families across the state call in and say, my kid is sick, and it truly is a mental health issue, but they have to say it's a physical health issue. And so if we can change this law, I think that's such a huge step to tell every family in every school district around the state that there is parity between physical health and mental health. So I'm really looking forward to that. And I'm actually very, very hopeful. When I moved that bill of mine out of committee, I had full support from both sides of the aisle, and people were very on board. Another bill I have is also related to schools and young people and mental health, and that is a suicide prevention bill. And we already do some good work on suicide prevention in Illinois. School districts around the state, all of them, and there's 851, somewhere in that ballpark. So every school district around the state has to do suicide prevention and intervention based on a law that we passed in 2015 before I got to the General Assembly. So the bill that I am working on would compel school districts to recognize and put into their suicide prevention plan that there are certain populations of young people who are at a heightened risk for suicide. It's just the facts. When you look at the data, it's just the facts. So overall, this is a huge problem, and this is very heartbreaking, but suicide is the second leading cause of death for young people ages 10 to 24. Which is truly heartbreaking. So it's a huge problem. But if we look at, and here are some of the populations at heightened risk: LGBTQ youth in homelessness, youth who are in out of care placements, such as the foster care system, youth that have a diagnosis for mental health or substance abuse, youth who have been bereaved by suicide. If somebody they know has committed suicide, all those youth, they're at even more of it's more than the second leading cause of death. So this bill would compel school districts to integrate that into their plan and work with everyone, but recognize that these populations are at heightened risk. And then finally, I have another bill related to first responder mental health, which, for all the reasons the senator said, has always been important and is extra important at this moment in time during COVID, as all our first responders have been working throughout. And during this time of very, very public conversations about police reform, which you know, I know, and we know, the senator I know, because we've had many conversations with current and retired first responders, that they do not feel valued right now. So I have a bill that creates the First Responder Bill of Rights, and excuse me, First Responder Behavioral Health Care Bill of Rights. And it lays out some things like the trauma that first responders have to endure every day, the barriers to treatment caused by stigma, caused by fear of discipline or repercussions. And that is a specific thing that police officers and firefighters and even EMTs have to deal with. So it lays out some things and says first responders need to have access to behavioral health care without these barriers that we know have been a historical issue. And the rights that are laid out here in this first responder behavioral health care Bill of Rights are guaranteed and judicially enforceable. So those are the three bills I'm working on. I know we're very hopeful. What are some reflections that people have on some of the legislation we have going on?
All of those sound amazing. I was personally struck by especially the legislation for students and addressing suicide prevention. This is kind of coincidental, but years ago on this day, March 20th, I lost my best friend to suicide in high school. And he was part of the LGBTQ community. You know, over the years since, I've definitely wondered many a time, you know, if there was just more care available, what could have been different. And, you know, that death is largely the reason why I'm in this field today. And so it's just so important, because it not only impacts that person, you know, the lives that are lost so tragically early, and right, the loved ones that, you know, they leave behind. So thank you both for, you know, championing those causes.
I think they sound tremendous. And, you know, Laurel, I absolutely concur with you on the suicide prevention. And I love that these bills really sound like they are addressing a lot of roots of stigma, in recognizing that in the field we talk about ACEs, or adverse childhood experiences, things that place you at a higher risk for more trauma or health issues later. And so I'm hearing in this bill that you're acknowledging ACEs, acknowledging risk factors to create more support for individuals who are at higher risk through less resources or being part of a marginalized population. And also what I'm hearing in terms of the care that you're both working to provide first responders. I think that a lot of the structural issues that we may be facing are exacerbated when people say, no, you should be able to deal with your own problems. You're strong, you rescue other people. So if you're a little bit stressed, don't worry about it, just blow it off. And these are, if you're dealing with PTSD or anxiety or depression or any of these things, you know, as the senator pointed out, your brain is an organ. It does have stuff to do in your body. It will affect you. And if your strategy for coping is to just repress, or if that's the option available to you because colleagues, supervisors, whoever else would judge you, look down on you, you don't think you can get access to care without somebody knowing, and then there would be weirdness from people around you and judgment, then of course, more likely to repress, and it basically becomes this internal pressure cooker where something bad is going to happen, whether it's something bad relationally, something bad with someone else on the job, something bad in terms of a person taking their own life or just suffering terribly and suffering in their relationships. Any one of those things are just going to add to stigma and add to suffering in the world for people who signed up to risk their lives to help other people. And to me, that, I can't say that word on the air, but it sounds like something. So thank you so much for backing these.
And thank you for saying that, Nikki, because, you know, Lindsay and I both represent the area where we live out here. We represent a lot of first responders. And a mutual friend of ours, you know, during all of the unrest that was going on over the summer, you know, he works in he patrols a very economically disadvantaged area that is high violent crime. And because of budget constraints, we're actually, you know, people argue about what the right amount of staffing is for police officers. But what I will tell you is that this person, I think at one point, worked 23 straight midnight shifts in a high crime area, 23 straight days without arrest, because the city would call him in and say, no, you can't, you're scheduled for time off, but no, you got to come in and you got to work. And you think to yourself, so they're working difficult hours, difficult situation, seeing really the worst of humanity at times. And as you said, this pressure builds and people are shocked that they make bad decisions. I'm like, you'd think that would be the default, would be a bad decision given what they're facing. And so that's really, you know, the cause behind this is you know, I can't solve all the problems. I can't make their shifts normal. Someone's got to work a midnight shift. I can't make every neighborhood patrol someplace safe. I certainly can't provide enough resources for the city to hire everyone it needs so that people have adequate time off. And that's not my job. That's someone in the city's job. But at least addressing this issue, saying if you are feeling that pressure, there's got to be a release valve for it. And so that's the idea behind it. So thank you. As I heard you talk, I said at the beginning, and I'm so grateful to be here today because, as I said, this is such a learning process for me. And even today, hearing the things that all of you are talking about, it's just helping me understand the things that I'm doing that much better. So thank you.
I think the thing that sticks out for me, a stigma, absolutely, which I love, because that is so important that we know that, again, mental health is a part of being a human being and we can all struggle. Another thing, though, that I love is this connection that mental health care is healthcare, because I think I have clients who have been struggling with symptoms for years and years and years and never had a medical professional say, oh, do you think maybe it might be linked to your anxiety? Do you think maybe it might be linked to what happened in your childhood, like the ACEs Nikki talked about? And so I think the more that we connect these things, I hope the more we can connect the medical community together to be working together on an integrative and holistic approach, because I just think that's so important to be able to understand that what could be happening physiologically is connected to the brain. Everything starts with the brain. So it's not that you're feeling something in your foot is not connected to the brain, you know, and when people say it's all in your head, yeah, that's right. It is in my head. It's in my brain. So those things are all connected.
Well, we are rolling up to 5:15 and we don't have a lot of questions coming in, which is fine by me because it's a beautiful day out there. But the beauty, as we all know, of this type of virtual event is it's going to be archived on Facebook and then people can access it at their leisure. And just to kind of really hit home how and why destigmatizing is so important. Me, as an elected official, having a platform, I know the senator feels the same way. Even us just talking about mental health and putting it out there on social media invites people into the conversation, and that in itself can chip away at stigma. January 2021, the senator and I did an event at Wright College with the NAMI Chicago, which is the National Alliance on Mental Illness. And we worked hard to make it as accessible as we could. This was probably the last in-person event that we did before everything shut down. We had 2 different sessions of it. One was during the day, one was in the evening. The point was to make sure our young people or anyone who's a student at Wright College could access it. And one of my big takeaways from that event, and back then I was an even newer elected official than I am now, is to see what people's reactions were, to see that when leaders and people who are so lucky that we get microphones and we get to stand on podiums and we get to create agendas, when leaders talk about mental health, eyes widen and people open up and people are ready to share their stories. And that happened when we were at Wright College back in January 2020. We had parents stand up in the audience and start sharing the difficulties that they've had helping their students and their young people access mental health. We had a young woman, a young Latina woman, stand up and talk about how for her it's particularly challenging because the mental health service system, she didn't feel like it was set up for her. So that, just thinking back, that was a very powerful experience for both the senator and I, but also making sure we continue to talk about these things as leaders on podiums and to create spaces for people like you who are on the ground navigating and helping other people navigate mental health. That in itself is a really important tool to chip away at stigma. So thank you for being a part of this conversation, to all of you. I will, if anyone else wants to chime in with any closing thoughts, I welcome you to do so, and we'll make sure that this conversation is archived so people can access it at their leisure.
Well, I'll chime in with some closing thoughts. Again, I think that this is a learning process, and I hope that this video helps serve to educate other people about, not just the things that we're doing, not the bills. That's not important. Those bills are not something that while the end result may affect everyone's life, their existence is not going to. The bill's existence or the process of a piece of legislation moving through Springfield is not going to change anyone's life. But really, it's hopefully this discussion continues to be an educational experience for people that may be experiencing, because of COVID, who've never really had to deal with this, but because of those changes, feel like it's okay that they can reach out. And then, as you said, whether these bills pass or not, right? Students need to know that it's okay to address their mental health, right? And again, hopefully we can get these bills passed. You'd say, well, why can't we? But legislation is a difficult process sometimes, and there are competing interests. And so hopefully we can get these things done. But if they don't, hopefully there's a student that watches it that says, hey, maybe it's okay for me to address my mental health problems. Maybe there's a police officer who says, I've seen a lot in my life, and maybe I should reach out to someone to get some help on this. And that's my hope from all of this. I'm grateful for all of you and all of your time today, and continuing your education for me, the work that you do. I'm so glad to hear that that telehealth is helping people connect with you that otherwise, I assume, Jamie, that your new client from Carbondale would not be driving in for a monthly visit. So I'm happy to hear those connections, and hopefully that this continues us on the right path and keeps us moving forward. So thank you again, Representative LaPointe, for setting it up. Thank you, Jamie, Nikki, and Laurel for all of your input today. And for anyone who's watching, if you think that these things are important, these pieces of legislation, reach out to your representatives and your senators and let them know that these are important, and that would help us a lot towards getting this legislation passed. So with that, I'll turn it back to Lindsay or any of the panelists who want to close. I'm, again, just grateful to be a part of this. Thank you all.
Terrific. Thank you, Senator. And you actually partially addressed one of our questions that came in. And that is somebody, Tracy Baldwin, who thinks these bills are really important, super helpful. What can constituents do to make sure we get these bills across the finish line? And the answer to that is reach out to your elected officials. I personally think email is tremendous because you can write how it affects you personally. We are having this conversation today because Jamie and Nikki reached out over email to tell me about why ensuring telehealth into the future for mental health is so important. So we as electeds, we do take in all the communication that comes in. And my best advice for when you reach out to your elected, having a boilerplate email is better than nothing. But if you can just take a few moments and make it personal and talk a little bit about why this is so important to you and your life and your family, that's even better. So that's my advice for how you can help. All right, I think we're going to close out. Thanks so much, everyone. Let's keep talking about these issues.
Thank you.
Thank you so much.
Bye, Laurel, Jamie, Nikki, and Senator Martwick.